Okay, so for everyone starting to get into PRF, or if you've dabbled in it here or there, I wanted to answer the most common question that I get. How deep do you put in the needle when performing venipuncture? And when we do hands-on courses, I see this as always being a cause of concern. When people are first starting out, well, we're all a little nervous. Like, how am I supposed to put this needle into this vein that I can clearly feel and see? But then on the other hand, I can stick a huge needle on the back of someone's jaw and almost bury it to the hub and blindly anesthetize the inferior alveolar nerve. We're all nervous, but you can do it. So when you're nervous, well, you only stick the needle into the vein like a 0.5 millimeter, and you see the blood gathering subcutaneously, you know the oncoming bruise is coming, and then you move or the patient slightly moves and bang, you're out of the vein. Or on the other hand, you put the needle in too deep and you go right through the vein. So you still get blood flash with your needle, but then when you go to connect the vacuette tube, nothing comes out. Hint, it's because you've gone too deep, maybe even at the wrong angle, and you're right out the other end of the vein. So that's not good either. Well, really, it's all about finding that sweet spot. You don't want to be too shallow or too deep. You want the needle to be stable and blood flowing well in the vein. And I find when the needle is halfway in the vein, depending on the size of the needle, and you can stabilize the tubing with your finger and let go of that needle, as you can see here, it's just perfect. As well, if you have that flash and you connect that vacuette tube and nothing comes out, just pull back on that needle like 1 millimeter and you'll reestablish blood flow because that needle will now be inside that vein. I hope seeing this video helps you along your PRF journey. And of course, we will be going over all this and so much more in Vancouver at Bites. I hope to see you there. Let's get it.